Hi, welcome to attend our online lecture today. We are going to talk about the canine parvovirus and its challenge in clinical diagnosis. Before today's lecture, let me briefly introduce myself. I'm Yongchun Luo. I got my DVN degree at Taiwan and PhD degree from Mississippi State University. After I got a PhD degree, I work as postdoc at University of Florida. Currently, I'm working as a technical support manager at BioGuard Corporation. In today's lecture, we are going to discuss canine parvovirus, or CPV for short, and also in a myth in clinical. That's a bad question why the CPV rapid tests show negative results in those severe cases. So let's start today's lecture. CPV is small single-strand DNA virus. It can cause highly contagious disease in dogs. The common clinical manifestation include acute gastrointestinal illness in puppies and myocarditis in neonatal puppies. For puppies between 6 and 24 weeks old are the most susceptible for the CPV2 infection. This CPV2 first emerged in Europe around 1976, and just in a short 2 years of period, this virus already spread around the world and caused a worldwide epidemic disease in dogs. The CPV2 is believed to be evolved from the feline panleukopenia virus. The feline panleukopenia virus is also a parvovirus, so sometimes we just call it feline parvovirus or FPV for short. FPV origin can infect the cat and also in the raccoon and fox. Right now, we believe the FPV make the species jump from the cat to the raccoon or fox, and then it make another species jump to the dog. And during those species jump, the virus, of course, occurs some amino acid mutation. When we compare FPV and CPV2 virus, we find that there are actually 6 or 7 amino acid mutations in the BP2 gene, and 3 of the mutations in FPV make this virus can infect the dog, and another 3 mutations in FPV BP2 gene make this FPV cannot infect the cat again. As a result, after this species jump, the CPV2 only infect the dog but cannot infect the cat. And after the CPV2 appear, the evolution keep going up. Later on, the variant CPV2A appear. The difference between CPV2 and CPV2A is mainly in the BP2 protein. And this time, 3 of the mutations in BP2 protein make the CPV2A can infect the cat. And then the evolution keep going on. So later on, CPV2B variant and 2C variant appear later. currently there's no CPV2 infection for the naturally infected dogs, but the CPV2 variant like 2A, 2B, and 2C are still very common around the world. That's the 2A, 2B, and 2C. You can see a little bit update here because the 2C also already been reported in Australia, Thailand, and Peru. The risk factor for CPV infection is many like the young, like between age of 6 weeks to 6 months old, unvaccinated or incompletely vaccinated dogs are most susceptible to this infection. In addition to this factor, the breed also played a role in the CPV2 infection. Some breeds like Rottweilers, Doberman Pinschers, American Pit Bull Terriers, English Springer Spaniels, and German Shepherds are the species more susceptible to the CPV2 infection. So, why the dog that can get infect after the infection will show the clinical sign? They are actually decided by 3 factors, like host factors, such as the immune status of the dog, and environment factors like humidity and temperature of the environment, and also the variant of the virus dog is exposed to, including the viral load. This combination of the combination of the 3 factors will decide if the dog becomes infected. And then let's take a look at the pathogenesis of the CPV2 infection. The virus is very stable to adverse environment. It can usually survive in the environment for up to 6 months or even longer in some survey. And also the infected dog usually will shed large amount of the virus from their feces. Once the unvaccinated or poorly immunized dogs come direct or indirect contact with the feces or vomit from the infected dogs, or even the contaminated objects, and they may by those contact to get the CPV2 infection. The main infection route is the oral-nasal, by oral-nasal route. Once the virus get into a dog's body, they will first target the rapidly dividing cells, or we call this mitotically active cells. So first they attack tonsil or lymph node of the throat. Over there, they embed lymphocyte and replicate inside the lymphocytes, and then the virus will get into the bloodstream. Once get into the bloodstream, those viruses will again to attack some other rapidly dividing cells in bone marrow. Inside the bone marrow, the CPV2 will destroy young immune cells for the white blood cells, including the neutrophil lymphocyte, and this will cause the protective white blood cell count drop. Once those white blood cell count drop, definitely will destroy the immunity of the dog. Or they attack the germinal epithelium of intestinal crypts. Once they attack those epithelium, it will cause destruction and collapse of the epithelium. And as a result, the fluid loss from diarrhea will occur. And also, when dog lose those epithelium, it will lose the barrier to protect the body from bacterial infection. As a result, the secondary bacterial infection will occur in those infected dogs. Or they may attack the heart in the neonatal and cause the inflammation of heart muscle or the poor function of the heart and arrhythmias. And once the virus replicate inside the small intestine of the epithelium, the virus will also be shed from those feces. The clinical signs for the CPV2 infection is strongly depends on the age of the host. Like for the myocarditis, only occurs for those puppies in very young age got the infection. That's probably due to the active cell division of the myocardial cells in pup only under 15 days of age. And the similar clinical sign will be observed both in wild and domestic animals. The common clinical signs include depression, loss of appetite, vomiting, high fever, and severe diarrhea. Some will with blood, some may not with blood. And the clinical sign of parvoviral enteritis generally develop within 5 to 7 days of infection, but can range from 2 to 14 days of post-infection. And here we'll take a closer look at the pathogenesis of diarrhea in the case of CPV infection. This schematic figure here is just show the normal intestinal epithelium. In this yellow cells, that's where we call the germinal epithelium of intestinal crypts. That's where the epithelium cells produced. Once the epithelium cells are produced, they will migrate and mature. Eventually migrate to the tips of the villus, and over there they also acquire the absorption function. Once the CPV attack the germinal epithelium of the intestinal crypts, it will cause destruction and collapse of the epithelium. And for some other intestinal virus like rotavirus, it usually only attack the top 1/3 part of the intestinal epithelium. And for coronavirus, it usually attack the top 2/3 parts of the epithelium. So that's why, although those two viruses also attack the epithelium of intestine, but the diarrhea caused by those two viruses are much mild compared to the CPV2. So as the intestinal epithelium is destroyed, then it begins to slow up and cause severe watery and bloody diarrhea, like the figure shows here, and it will leading to dehydration and electrolyte loss. And not only that, those epithelium is actually working like it as a barrier to protect the body from direct contact with the bacteria. So once those epithelium lost, the bacteria will direct contact with our intestinal, and then as a result, the secondary bacterial infection is common for those CPV2 infected dogs. And for myocarditis, it usually occurs up to the first 4 weeks of the age, or when the puppies, the fetus, they may infect as the fetus when they're still inside their mother's uterus, and it will result in sudden death or congestive heart failure of those young puppies. And in their heart, we may observe the pale streak. And some of the clinical signs for the cardiacitis include the cardiac arrhythmia, cardiomegaly, myocarditis, dyspnea, pulmonary edema, pulmonary congestion, and then the interstitial pneumonia, and followed by the death. This table shows the physical examination finding on admission in 94 puppies with spontaneous CPV enteritis, and that's the common clinical sign observed from those 94 puppies. And we can see, even that's the common clinical sign, not every puppy will show all the clinical signs. So the common one is just the depression, lethargy, anorexia. All those are not that specific to the CPV, only to the CPV2 infection. And for the diarrhea, about half will show the bloody diarrhea, but not all of them. And these two tables show the hematological and serum biochemical abnormality observed from 70 dogs with the parvoviral enteritis. And we can see just the anemia, leukopenia. Some of them even show the leukocytosis and thrombocytopenia, the lymphopenia, neutropenia. So not every dog will definitely show the white blood cell count drop. So that's need to be kept in mind. Although the white blood cell count is a significant index for the CPV2 infection, but not all of them will show. I think that's probably may related to the cause of the infection when they observed in this study. And for biochemistry abnormality, some of them will show the hypoproteinuria and hypoglycemia, or even the hyperglycemia. So not all of them will be the deciding diagnosis better, but still just some of the easy one to observe during the parvovirus infection. So once the vet suspect the CPV2 infection based on segment history and clinical signs of the dogs, they run the blood test. From that blood test, we may observe the white blood cell count drop, and then the vet may order for some in clinical test using the stool sample like ELISA test and rapid test. Those tests are easy to handle in clinical and just take a short time, like 10 to 15 minutes. You can get the results. And the other test can be performed is hemagglutination assay. This assay use the we run this assay because CPV2 virus have the ability to make the red blood cell agglutinate. But this one need to be performed in a lab, probably not in the clinical. And some vets may send a blood sample to the lab for PCR test. And PCR test still is the most sensitivity and specificity diagnosis method for the CPV2 infection. Once the CPV2 is diagnosed, there is actually no cure for the parvovirus itself. So usually just give some supportive therapy, and while that the dog's body recovers on its own. However, if we leave the infected dogs untreated, the mortality for CPV2 is over 90%. But with prompt treatment, more than 80, probably more than 70 or 80% of the puppy of the dog can recover from the CPV2 infection. The treatment usually include the flu therapy to counteract the dehydration and electrolyte loss of the dog, and usually the lactic Ranger solution is a good choice. And then the vet will give the antibiotic treatment to prevent potentially fatal secondary bacterial infection. And the enzymatic treatment to control the vomiting from the dog. Also, the nutritional support for the dog is also important. Other treatment like antiviral treatment, such as interferon omega and pain management, may also be included, and some may treat with plasma or whole blood transfusion, as it depends on each dog's situation. This table shows the most commonly used drug in canine parvoviral enteritis. The first three are just the common used antibiotics to prevent the secondary bacterial infection. And the four drug with blue color is just to control the vomiting of the infected dogs, and the last two is the pain management drug. The best way to prevent dog from CPV2 infection is via the vaccination. And since the CPV2 is so severe, can cause the severe even fatal for those young puppies. Definitely, this CPV2 vaccine is belong to the core vaccine. That means every dog should be given the shot of the CPV2 vaccine. And in puppies, the shots are usually given every 3 to 4 weeks from the time of the puppy is 6 to 8 weeks old until they reach the age of 16 weeks. And after that, a booster vaccination is recommended 1 year later, and then with the booster every 1 to 3 years. And this figure here is show the maternal derived antibody inside the puppies, the newborn puppies. The pink curve is the maternal antibody level, and the first line here, that's we call it protection line. If the maternal antibody inside the puppy is above the protection line, then this puppy will be protected from the CPV2 infection. But once the maternal antibody drops below the protection line, then the puppies are susceptible to the CPV2 infection. And the blue line here, we call it interference line. That means if the maternal antibody inside the puppy is above the interference line, during that time, the vaccination won't be effective at this stage, because the maternal antibody will neutralize the virus, the vaccine strain of the virus. Once the maternal antibody level drop below the interference line, at that time, the vaccination will be effective. However, let's see, there's a window we call window of susceptibility. That means if the maternal antibody is below the protection line but above the interference line, at that time, even though the maternal antibody cannot protect the puppies from the CPV2 infection, but this antibody can still interfere the vaccination. So during this period, this window is actually, if the puppy contacts the CPV2 in this period, they may get the infection. So that's the most vulnerable period for the puppies. And for the dogs, if they stay in a more intensive, in a sheltered environment or in a high prevalence area, the more intensive vaccination program may be required. So for those with significantly increased risk of exposure, the vaccination can start as early as 4 weeks and through 18 to 20 weeks of age, and need to revaccinate the puppy every 2 weeks. So this usually recommend for the dog stay in the sheltered environment. And as we mentioned, this virus is very stable in the environment. So once we know there's an infection, to cleaning and disinfect the contaminated area environment is very important. Usually, Fortunately, usually the house bridge can do this. So for those environment or the food balls, water balls, and other contaminated items need to be careful, thoroughly cleaning and disinfection. And then let's take a check at myths. Lots of vets may wonder, why do CPV rapid tests show negative results in severe cases of CPV2 infection? Let's take so here we will share a case, a clinical CPV2 case. This case on July 26 of 2021, they visited the hospital. This the reason for the hospital visit is the 3-month-old pups are living in outdoors, and they are from the same litter, and they got first dose of the CPV vaccine 1 month before the hospital visit. That means they got their first shot at the 2 months when they were 2 months old. This dose, 2 of those puppies show severe vomiting and severe bloody diarrhea in 2 of them, like the figure shown here. And the blood test also show hypoglycemia and low white blood cell count. And those 2 puppies are so severe that they died within 2 hours at the hospital. And the 3rd puppy, at that time, during the hospital visit, only show the fatigue in the patterns, and the white blood cell count is still normal. In other words, it just have mild, very mild symptoms. And based on the clinical signs, signalement, and the low white blood cell count, the vets suspect the CPV infection for those puppies. So they use the stool samples from those 3 puppies to run the rapid test. And then the rapid test show, as we see from this figure, the 2 severe puppies, here we call puppy A and puppy B, all show the CPV negative, while the 3rd one we call puppy C show the CPV rapid test show the ban, means the weak positive reaction. So the vet asks a question: why did the CPV rapid test show negative results in those 2 severe cases, but the positive result in the puppy with mild symptoms? To answer this question, the same stool samples were shipped to our reference lab the next day, and we also run the rapid test comparisons study, and we use our own rapid test and the other rapid test to test those stool samples, and similar results were observed compared to the vet conduct in the clinical. For the puppy A and B, the severe cases both show negative results, while the mild puppy C, show the positive reaction. So we also run a PCR confirmation for those 3 stool samples. This time we test two different primer set for the CPV PCR test. Both primer set show all three puppy are the CPV positive. And also the PCR product was sent to the sequencing lab to do the DNA sequence, and the sequencing data indicate all three dogs infect with the CPV2C variants. To further explain this situation, we run a semi-quantitative PCR. This time, we use the same amount of the stool sample to do this test. After the semi-quantitative PCR test, we find out puppy C, that's the mild one, have more DNA, CPV DNA in its stool sample, while the two severe puppies only have much fewer DNA copies in their stool samples. So to properly explain this situation, let's go back and check the pathogenesis of the CPV2. Once the dog is exposed to the CPV2 virus, the first few days would be the incubation period. That means we won't observe any symptom. But like in day 3, although the symptom not appear, but at that time the virus shedding already started. And when usually the clinical sign begin 4 to 10 days after the exposure, and some dogs may even wait a little bit longer for the clinical sign to show up. But anyway, during this time, of course, the virus shedding is still keep going on. However, the shedding will start to decline, like begin to decline at 6 to 10 days post-infection. And during this period, if we use the stool sample at this period, then the rapid test or the ELISA test may show the false negative result. Not to mention, after day 12 of post-infection, the virus is already rarely recovered in the feces. And of course, this for the rapid test or ELISA test. And if it's the PCR test, since it's more sensitivity, have higher sensitivity, so PCR can detect a little bit longer period of the virus shedding. So in conclusion, for this question, why the CPV rapid test show negative results in severe CPV cases? The answer is the animal can test false negative on this test if they are shedding small quantity of antigen in early or later phase of illness. And of course, in this case, it's like because those two puppies are already in the later phase of the illness, and the shedding, the CPV2 shedding is less than the detection limit of the rapid test. As a result, it shows a false negative. So that's for today's lecture, and we'll take a short break and then we'll go back for the Q&A session. Okay, here we'll answer the first question from Thomas. The question is how the adult dog impacted by the CPV. Parvovirus do primarily affect puppies, but dogs of any age can be affected if they are unvaccinated or haven't previously been exposed. The study has shown that shelters take in a greater percentage than vet clinics of adult animals without prior protective immunity against the parvovirus, and it is not unusual for adult animals to be affected during shelter outbreak. This is why vaccination on intake is such a crucial tool in limiting disease. And the second question is, if we leave an area or cage empty for a period of time, will help eradicate the virus. Actually, both for the CPV, because CPV is an envelope DNA virus, they are very durable and can persist in the environment for months to years without proper sanitation. Sanitation is a two-step process that involves physical cleaning followed by chemical disinfection. Additionally, only a few disinfectants such as bleach derivative or potassium peroxymonosulfate and accelerated hydrogen peroxide products reliably kill the virus. So while repeated cleaning and disinfection can be helpful, especially in old facilities where the environment may present a challenge to clean. Through sanitation in one day is just as effective as 3 times in 3 days. So hopefully that can answer the question. And the last question is asking about, is there a vaccine for the CPV2C? Although there is no CPV2C vaccine, studies have shown that all the currently available vaccines produced by the major vaccine manufacturers, when administered approximately, provide excellent immunity to all variants of the canine parvovirus. And actually, currently vaccine, including one of the 2 strains. Some vaccine use the original CPV2 virus, and some of the vaccine use the CPV2B variants. But in the end, both kinds of vaccine strains can provide good enough immunity for all variants if they are immune, if they got the proper immunization. So there's no need to worry about the variant and the vaccine strain. So that's all for today's lecture. Thank you for the attending.